This presentation is brought to you by Team Vector9 and is a summary of this semester's fieldwork. We hope you enjoy. This presentation is brought to you by Team Vector9 and is a summary of this semester's fieldwork. We hope you enjoy. The importance of fieldwork. Epidemiologists investigate the causes of disease and other public health problems in an effort to prevent them from spreading. Epidemiologists conduct fieldwork to determine what causes disease or injury, what the risks are, who is at risk, and how to prevent further incidences. As a team, we conducted this semester's fieldwork at Queens Medical Center Diabetes Outreach Program, CalWorks of Orange County, Waimanalo Health Center's Women, Infants, and Children's Program, Hawaii's Department of Health's Injury and Prevention and Control Group, and Department of Health's Central Region offices. Queens Medical Center Diabetes Outreach Program. We met with Grace Schonhart, who works within the Queens Medical Center Diabetes Outreach Program, where she implements a program specifically for discharged diabetic patients who require essential follow-up care, including blood pressure monitoring and disease management. The program came about from her own fieldwork, in which she realized certain high-risk groups would often get readmitted to the hospital. She relies heavily on the National Data Bank as well as the state's Department of Health data on diabetes. She collaborates with the hospital, the Center for Outcomes and Research Evaluation, insurance companies, and other organizations, as she is on the state's task force on diabetes prevention. California Work Opportunity and Responsibility to Kids, also known as CalWorks. A phone interview was conducted with Sue Hall, Senior Public Health Nurse for CalWorks of Orange County, to discuss the role of the public health nurse. CalWorks is a welfare program for the low-income California population. Nurse Hall works as a case manager for communicable diseases. She receives positive lab values from outside sources, and it is her job to review the labs, speak with clients, and backtrack to determine what the disease is. After she determines the disease, she would then report it to the physician and make recommendations on either the disease itself and management or how to prevent it in the future. She also emphasized the increased rates of hepatitis B infection in dialysis patients and the increased rates of pertussis. It is the role of the public health nurse to train dialysis nurses on proper technique to prevent hepatitis B transmissions to the dialysis patients and to provide education on the importance of vaccine administration. Waimanalo Health Center's Women, Infants, and Children program, also known as the WIC program. Our next interview was with Kim Magita, Advanced Public Health Nurse and Supervisor for Waimanalo Health Center's WIC program. WIC was established in 1972 and permanently authorized in 1974 under the authority of the USDA. The program was developed after the 1969 White House Conference of Food, Nutrition, and Health concluded that nutritional deficiencies posed a health threat to low-income women and children. It has also been shown that pregnant women who enroll in WIC have a lower risk of premature births, seek prenatal care earlier in pregnancy, and have a higher intake of iron, protein, calcium, and vitamin C than those women who are not enrolled in the program. Different food packages are offered for pregnant women, breastfeeding mothers, postpartum mothers who supplement with formula, and for infants and children up to the age of 5. As a nutritionist and public health nurse, Ms. Magita also provides counseling to mothers and children up to the age of 5, with an important focus on preventing childhood obesity and encouraging immunizations. Through counseling, the nutritionists at WIC offer nutrition education, breastfeeding promotion, preventing anemia by providing iron-rich foods, and encouraging physical activity. Ms. Magita stated that the program uses primary and secondary prevention to prevent childhood obesity. Nutritional counseling, follow-up weight measurements at each appointment, and nutritional food packages are offered as forms of primary prevention and secondary prevention. While the program serves low-income women and children, Ms. Magita stated that the main population they serve is Native Hawaiians. The program offers many benefits to prevent disease and childhood obesity, including nutritional counseling and nutrient-rich food packages. Department of Health's Injury Prevention and Control Group, also known as the IPCG. Our next fieldwork assignment was conducted with Dan Galanis and Debbie Sanders at the Hawaii's Department of Health's Injury Prevention and Control Group, which is located on the Leahi Hospital campus. The major function of the IPCG is to help decrease the incidence of injury mortality in the state. Primarily, they work to collect, assimilate, and distribute statistics to various partners within the state. Suicide remains the most prevalent injury fatality in the state, accounting for nearly 24% of all injury fatalities during this time period. Fatal injuries from falls were noted to be the second most prevalent, with 16% of the total fatalities during the 4-year period. The IPCG group works with community partners to help drive intervention and planning aspect to prevent injuries in the state. As we know, education is an important intervention in injury prevention, and the intervention is addressed through multiple facets, whether it is environment changes with traffic safety, behavioral changes through PCAs and educational curriculum in the schools, for example, child safety, enforcement campaigns by police departments, and also judiciary involvement to help institute laws and enforcement. Data appears to be the driving force for any intervention and is the key to prevention. We definitely see firsthand how data drives these programs. Department of Health Central Region Offices. For our final fieldwork assignment, we interviewed Holly Kataoka, public health nurse who has worked for the Department of Health for over 4 years and is located in the state offices near Wahiawa General Hospital. The Central Region of Department of Health's public health nursing consists of covering 21 public schools from Salt Lake to the North Shore, covering about 19% of the school-aged children on Oahu. They are used to coordinate nursing function in schools in various fashions. For example, they supervise school health aides, direct flu clinic at schools, and serve with partnerships with other state organizations. They consult and manage individual cases and provide educational training at schools to students and/or faculty. The public health nurses supervise the school health aides with training and overseeing direct services. The public health nurse may be called to help support the school aide via medication management and direct communication with physician services. The public health nurses are all presently overseeing the flu clinic for both private and public schools. This is in collaboration with the Department of Health's immunization branch. Together, they provide flu immunization to over 30,000 school-age kids annually. The Department of Education may consult public health nurse services for more complex, medically fragile children with special needs in schools. Individual educational plans and coordination may include students with diabetes, seizure disorders, and/or asthma. Public health nurses may also be used with Department of Human Services to conduct home visits and assessments for possible and/or suspected child abuse and neglect. The Department of Health's Maternal and Child Health Branch may use public health nurses to provide education on prenatal care for at-risk school-aged mothers. Even with Department of Health's Emergency Preparedness Department, public health nurses are used to help provide coordination of services for at-risk regions. Ms. Kataoka currently interfaces with the North Shore community to help them prepare when disaster strikes. This concludes our presentation. Thank you to everyone who participated in our fieldwork assignments. We have truly learned what it takes to be a great public health nurse and the role of epidemiology in public health. Thanks for a great semester.